being a healthcare assistant is very, very different to being a medical student. The skill set is completely different. The expectations and the responsibilities are really different. So I know that I speak for myself, but also lots of my peers as well, when it's been definitely a steep learning curve. We've had to really rely on other healthcare assistants and nurses to guide us and kind of tell us what we're supposed to be doing. We were lucky enough to have lots and lots of exposure to hospitals. Our program's been great, particularly on the graduate program that I'm on. We have, from week one, we're in hospitals with patients. So that aspect of, communicating with patients and other healthcare staff and being on the wards is not an unfamiliar environment, but in this different new role that we've taken on, and also in this different new kind of situation where wards that previously were cardiology wards have now been turned into COVID wards. It's all very different. We're all having similar experiences, I think. Quite a lot of us are on COVID positive wards. Some people are on kind of queried COVID wards. Other people are working in the emergency department. There's a lot of sadness, there's a lot of sickness, and there's a lot of death. But we're also seeing, lots of success stories and elderly people recovering and being able to go home, which has been brilliant. We're of course sharing, best practice for best to use our PPE, what best to wear in the mornings, because we're wearing disposable scrubs. But yeah, we're all also kind of making sure that we debrief with each other at the end of the day, because this is new and scary and can be quite sad. So we're making the most of coming home and making sure we talk about our days. In the medical school, there's 250 people have signed up to be healthcare assistants, and that doesn't even include the people who are doctor's assistants or the final years who are now graduating and being junior doctors. All the people who are working as, admin assistants. I've got people on my course who are working in labs doing COVID testing, people who are working in pharmacies, and people who are offering to childmind for doctors and nurses. It's just been amazing to see how everyone's just responded.